My name is Kelley Reed, and I'm a licensed clinical social worker. I went to my undergrad and got my bachelor's degree at William Jewell College in Liberty, Missouri, which is just north of Kansas City. And then I took a couple of years to think about what I wanted to do with that psychology degree. And then I went to University of Missouri, Columbia, and received my master's degree in social work. Well, I started off actually in a hospice and home health situation, and which I loved doing, and I loved going in patients' homes and having that one-on-one experience with them and also their families. Very difficult time, but I really enjoyed it. And then I also got involved with substance abuse treatment, and that wasn't because I was trained, it was because I learned. And so from experience I have that, and I've done both of those things over the years. So I've done those. Then most recently, I have done private practice a lot. Most recently, I've worked in the military population. And so I worked at Fort Leonard Wood and worked with military kids and their families. And I really enjoyed that as well. Cabool, I grew up, that's where I went to school all my years. So that is exciting to me. So I started kindergarten there years ago, graduated high school there. Then I left and came back, but I have a lot of family and friends who still live there. And that to me was appealing. It's close to my house. I live about 20 minutes away, but that wasn't all of it. It's just that community is home to me. That just speaks home. So I'm excited about being back in my community, my old stomping ground. I've worked with many different populations, and over my career, I always try to look at a strengths-based look at the client, see what works for them. We can say strengths-based solutions, but basically that's just seeing, well, you've done this before, look at how you handled this situation. Maybe you could apply it to that. Again, those are just things that sometimes we don't think about when we're in the middle of a crisis or something is becoming difficult for us. You know, I am a cognitive behavioral therapist. I'm very behavior oriented, and so I look at those things, but I think we have to look, I personally look at the whole person. How is this person doing spiritually? How are they doing medically? How are they functioning physically? You know, everything, not just behavioral health. I don't look at it as just one piece. I'm a very small helper in a big pond. So it's just looking at everyone from the whole aspect and getting to know them. So hopefully I bring an open mind and willingness to learn more and be open with any clients that walk through the door. I do lots of things. I live on a cattle ranch, and I wouldn't say that I'm a rancher, but I live there. I grew up there. My family still owns that, and so I like being outside. I have a big garden, and I garden, and I work outside, and I'm very meticulous about my lawn. I love to bake and to cook. I also I sing. And I act a little bit. So I'm involved with the Stars Foundation there in Cabool, Missouri. And so I enjoy all of those things. So I hadn't done any of that really in 40 years since college. And so I've just recently gotten involved with that again, and I enjoy that, so that aspect of it. So I'm open to lots of opportunities. I like to do lots of different things.